Emporium Forum. My name is Imelda Essien. I welcome you to our platform today. And today we're going to focus on the effect of kidney disease in the face of COVID-19. 10% of the population worldwide is affected by chronic kidney disease, and millions die each year because they do not have access to affordable treatment. According to statistics by World Health Organization, 1 out of 10 adults has kidney disease. Chronic kidney disease is projected to rank 5th in the list of causes of total number of deaths worldwide in 2040. According to National Kidney Foundation, over 2 million people worldwide currently receive treatment with dialysis or a kidney transplant to stay alive, yet the number may only represent 10% of people who actually need treatment to live. In the middle income countries, treatment with dialysis or kidney transplantation creates a huge financial burden for the majority of people who need it. In another 112 countries, many people cannot afford treatment at all, resulting in the death of over 1 million people annually from untreated kidney failure. So chronic kidney disease can be treated with early diagnosis and treatment. It's possible to slow or stop the progression of kidney disease. What is the fate of Nigerians? Or many people in the developing country faced with the pandemic situation, working so hard to have an enabling environment for everyone. We have as a studio guest today, Dr. Isah Umar. Is a consultant, physician, nephrologist, medical director, IBB Specialist Hospital. It's good to have you on our program today. I'm so happy to have you here, sir. With the recent pandemic situation, COVID-19, what happens to someone with kidney disease, or what can happen to someone with kidney disease who contacts this novel coronavirus?
Thank you, Imelda, for the question. If we just refresh our memory, COVID-19 epidemics actually came up somewhere far in Wuhan in China, late 2019, and it rapidly spread across the whole world. As at today, over 17 million people have been affected with the disease, and over 888 deaths has actually been, 1,000 has actually been occurred. And in Nigeria here, of course, we're also part of the global world. We have our own share. Reasonable number of people have been infected, and reasonable number of people have actually died. COVID-19, as name commonly called, actually affect virtually everyone, sex, irrespective of the sex or age, and it's quite more devastating in elderly people, particularly those that are suffering from chronic diseases, such as cancer, diabetes, kidney failure, and all that. The severity of the presentation is usually worst off in elderly people that have some form of comorbidity, such as kidney failure, as we have mentioned. So the people that has kidney disease are particularly prone to having COVID infection, and particularly worst off in them in terms of the outcome. That is, the prognosis is worst off in them. So by and large, people that has chronic kidney disease, either started on dialysis already, or about to start, or for those that even had a transplant, they are at increased risk of having COVID-19 infection. And to add to that, their severity, that is to say, mortality or the outcome, is usually worst off in them. For people that have kidney disease who have been unfortunate to have been infected with the COVID-19 infection, it is usual that they normally, in most instances, present with symptoms from mild to moderate, and in some few instances, it could be quite severe, to such an extent that they will be requiring dialysis, supposing they are not ab initio on dialysis. So that is generally the effect of COVID-19 on patients that um, are suffering from chronic kidney diseases. So having said that, we do know that people that are on chronic maintenance hemodialysis are also at more uh, disadvantage, or rather usually more affected commonly with this disease. And what it means is that they have more increased risk, more severity of the disease presentation, and the outcome is usually um, worst off. When it started in Warham, their initial assessment were that patients that were um, uh, patients that were on dialysis, mortality rate was much higher in them. In fact, the mortality rate in some series go as far as 20% or even more in some instances. So therefore, largely it is to say that people that are suffering from kidney diseases are more prone to having this infection, and if they do, they are more prone to also have a worst of outcome. That mortality then is actually higher.
How is COVID-19 affecting those who are doing kidney transplant surgery at intensive care unit? How is it affecting
Okay,
them?
again, these are special group of people who, after having suffered from chronic kidney disease, have been able to have their kidney transplant. And once the kidney transplant is done, largely the patient is maintained on what they call immunosuppression. Most of this immunosuppression comprises of steroid and immunosuppressant. These drugs are actually given to these patients in order to suppress the immune system such that they are able to accept the donated kidney in them and maintain its functionality. It by itself is an immune suppression. That is, it depresses the patient's immunity on top of the background chronic kidney disease, which is also another form of immune suppression. Now, this having been on this medication also worsen of their immune status, and therefore they are more also predisposed to having COVID-19 infection, as well as the mortality, just as I've said earlier, the mortality in them is also very high. In some studies, the mortality of people that have had a transplant, that's our transplanted patient who got infected with COVID-19, go as high as 25%. So you can see that the mortality rate is quite high in this set of people, because, of course, as it is, whether it is important that they maintain their immunosuppressant, because that's what keeps their kidney alive, and that's what invariably also keeps them themselves alive. So therefore, it is mandatory that they continue with the immunosuppressant, as yet it also predisposes them to having more of uh, increased risk for COVID infection and its severity.
Okay, so those who are already taking the who are already using the immunosuppressant supplements to, as in to help boost their immune system, what if they're already infected with this virus, or how would they prevent themselves from having this infection, because they have a very high risk of contacting the virus? So if
Yes.
they're already on immunosuppressants, how would they cope if they are infected with the virus, knowing that having kidney disease can cause a high risk of death?
Yeah. You see, to them now it's a double problem for them. There's background kidney disease. There is transplanted kidney with immunosuppression. So therefore, the risk actually increases quite high. Um, what they need to do is quite not too different from generality of the population, but in this instance, one, they must not stop their medications. They are advised to stay home and
Okay.
only go out when very, very necessary.
Okay.
And if they must go out, maintain social distance, that is at least 2 meters away from any other person, and they must properly be masked. In this instance, one will want to encourage them to use a medical mask, not just
Any facial mask.
Yeah, being that they are at special risk. And
Okay.
apart from that, they must be washing their hands regularly, even if it's at home. They can also use sanitizer if washing hand is not too available to them. And as if they have any complaint, they should connect with their healthcare giver to address their challenges. But by and large, they must stay away from the public. And this means that they must have enough stock of their medications, particularly those that will probably also have some additional comorbidity like diabetes, like uncontrolled hypertension, asthma, and all that. So those are additional comorbidity that will certainly increase their risk, and they are better off at stay home than to move about. So those are the
What would you
normal things.
say is their chances? Like, is it going to be a 50-50% thing, or is it going to be 70-30, or is it going to be 60-40? What is their chances of living? How long can they actually maintain this so that they won't contact the virus, knowing that they have high risk?
Yes. Now, like what we normally advise our patients, as I've said, is stay away from public, because the increased risk is, stay away from public. And if you must go out, then it must be with a very genuine reason. And the distancing is what is actually being stressed out. Stressed out for them, that you must maintain a social distance, you must wear a face mask, you must regularly and using soap and water, as well as hand sanitizers. So those are what we actually encourage them to do. And in doing that, we also certainly advise them, get all your your medications, all your necessary things, including food stuff, available at home to avoid you from going out unnecessarily.
How about those who are going to the dialysis center? What is their fate?
Now,
how can they cope? Knowing that you know the doctors actually advise that we should avoid physical contact and there should be a physical distance. So now for those who are already going to the dialysis center, how do they cope? How do they prevent this? Because I know it's a very sensitive matter.
Yeah, again, just like the use of immunosuppressant in transplanted patients, dialysis is another life-saving for people that have a chronic kidney disease and have become dialysis dependent. It therefore means that they must continue with their dialysis. Both WHO and National Kidney Foundation have encouraged them to continue with their dialysis as routine, that is, as prescribed, thrice weekly or at least twice weekly as possible. And in doing so, of course, certainly in our own practice here, dialysis is usually at the dialysis center, that is in the hospital base. We don't have home-based dialysis here. It does therefore means that the patient must certainly leave his resident or her resident and visit any of these centers. While this becomes necessary, you must maintain your thrice weekly dialysis to keep safe, to keep well, and keep alive. It is important that in this set of patients, while coming to dialysis centers, they are able to do all the necessary avoidable measures, like, of course, keeping distance as much as possible with the people, putting your face mask, your hand wash, your hand sanitizer, as much as that. Regularly at the dialysis centers, as much as possible, we keep trying to maintain a high level of aseptic environment to make sure that our machines are well clean and all that. And good enough, our dialysis products are usually a single use, so you use and discard. So the level of additional risk is there, but it's minimal. Now, just like I've said for the transplanted patients, as possible, they also stay home, avoid working about, get all the necessary things, including their medications. Particularly, most of them also have additional comorbidity like heart failure, get the necessary medications, diabetes, hypertension, and all that. So they make sure they get all their stuff home to avoid unnecessary going out, except for this dialysis, since that is their life-saving service they receive.
Okay. There's a video I want to play. This video was produced in 2015 there at the IBB Specialist Hospital. And then we actually show some people there at the dialysis center. So I would want us to show the video briefly. It's just for 3 minutes. And then when we come back, I would want you to address more issues concerning the patients at the dialysis center.
Kidney is said to have failed when it can no longer perform its normal function of removing waste products from the body, breaking down of complex compounds and production of certain chemicals to be used by the body. This can occur rather suddenly, acute, or gradually chronic over at least 3 months. Chronic kidney diseases affect about 10% of the world population. About 0.1 to 0.3% are in critical conditions, needing dialysis machine to take over the function of the failed kidneys. Some may need kidney transplant. The objectives are to raise awareness about kidney, highlight the diabetes and high blood pressure are key risk factor for chronic kidney disease, to encourage systematic screening of all patients with diabetes and hypertension for chronic kidney disease, encourage preventive behaviors, to educate all medical professionals about their key role in dictating and reducing the risk of chronic kidney disease, particularly in high-risk population environment, and to stress the important role of local and national health authorities in controlling the chronic kidney disease epidemic. Having discovered the number of people struggling to survive spending hard-earned money for dialysis without sponsors, and the number of people who started dialysis but could not continue because of lack of funds, or those that could not afford their transplant even when there is a donor, brought to birth the Kidney Foundation in IBB Specialty Hospital Minna, with a mission to ameliorate the plight of citizens diagnosed with kidney disease. Modern health facilities were procured for dialysis center for effective health delivery and to elevate the stress of patients traveling far and wide for dialysis. Statistically, from inception, over 150 patients have been dialyzed in IBB Specialty Hospital Minna, Niger State, although some were given conservatives. The dialysis room has been divided into 3 sections. The main dialysis room for normal dialysis patients, the second section for dialysis patients with hepatitis B, and the third dialysis section for dialysis patients with HIV/AIDS. Today, the most common causes of kidney disease in Nigeria include hypertension, diabetes mellitus, obstructive uropathy, HIV, sickle cell disease, drugs such as ibuprofen and diclofenac, bleaching soaps and creams include herbal medication. Stop alcohol consumption, do not abuse analgesic, treat hypertension and diabetes also. Remember, systematic screening of all patients should be encouraged. It may identify potential reversible risk factor for diseases, and it can reduce morbidity and mortality rates resulting from hypertension, diabetes, and chronic kidney diseases. Remember, your ₦1 donation can save a life today.
All right, welcome back. Yeah, we still have Dr. Isah Umar. He's a consultant physician nephrologist. He is the medical director for IBB Specialist Hospital. So this video now reminds me of the documentary we did in 2015, and then we were able to talk to some of the people that were having the issue and some of this challenge on the kidney disease. One of the challenges they had was on funding, and that will take me to my next question. That the current pandemic has caused a widespread on anxiety and has made a lot of people not to go to the hospital as they should, or even seek medical advice as they should. So, for kidney patients, what will you advise them? And I know that in 2015, you did something about your NGO, trying to see how you could help people who were having issues with funding, because some people couldn't even do dialysis 3 times in a week. So, what's your advice to these patients that are having this issue? And then I would like you to talk about your NGO.
Well, my advice for chronic kidney disease, and particularly on dialysis, at this phase of COVID-19 pandemic and lockdown in most of our states and all that, is that first of all, there is a mixed feeling about patients' patients' accessibility to the healthcare system, particularly to the dialysis centers. Even those that have been regularly, on the dialysis with us, because of this fear. Sometimes the symptoms, that's the presentation of the kidney failure, particularly when they are uremic, sometimes can mimic what ordinarily people will look at and say, this person has a COVID. And in view of that, patient would view or has this profound fear that once they go out to the public and to the dialysis, to the hospital, they are more likely to be labeled as COVID. But that is not actually the case, in that if they stay home, the condition will certainly become worse. So I continue to encourage them to link up with the dialysis center for their regular dialysis services. I also encourage them to maintain their medications for hypertension, for diabetes, for heart failure, and all that. Of course, they should as well get this stuff stock at home to enable them have accessibility to it. And particularly of importance is if they experience any new challenge, they should contact their health givers immediately for a solution and for necessary measures to be taken. Now, having said that, about our NGO, actually
Yes.
it's our hospital-based NGO, named as IPB Kidney Foundation. The foundation came up as a result of the challenges we were having with our patients. After a few sections, 2, 3, 4, 5 sections, majority of the patients are not able to. And we felt that if they have external source of support, that might help. So we came together as a unit and brought up the foundation with the dialysis patients, also a member. We started reaching out to individuals. We had a response from a few, and actually that has been life-saving for some people, because with this that have been on the dialysis, were able to move on to even have a transplant. They keep asking for support here and there. So some were able to get additional for the transplant. And I think a reasonable number of patients that have passed through our centers have had their kidney transplanted. A reasonable number of them are quite alive. I remember the first case of transplant we had was in 2013. And the guy is still alive, very healthy, and actually capable. Let me use that. So about to continue with the foundation, yes, perhaps the needed hub is not coming that much, but the little one that comes will actually ensure that they are being used judiciously for the patient. Particularly what we do, at any time we are able to have any assistance for anyone, which usually comes in form of consumables, that's dialysis consumables or medications. We normally give to patients that can afford. One section of dialysis, we give you another one free. One section of dialysis, we give you another one free, excluding those that are on company support or company support, or has somebody who actually caters for their dialysis needs. And that normally goes a very long way to soften the suffering of some of our patients. We would like to actually appeal to the populace, and particularly to the media, if they can also come to our aid by to ensure that people contributing to this platform. The contribution coming kinds. We should be ready to give links to where they can get these consumables done. But truly speaking, the foundation is existing and is assisting our patients reasonably.
Yes, doctor. Yes, doctor. You have our support, definitely. I remembered when we did the video in 2015, I felt so touched when I met with those people, and I saw the way many of them were just struggling to, raise funds to go for dialysis 3 times in a week. 3 times in a week. It's actually very expensive for them. And your NGO, I know it's your driving force. I know it's your strong passion, because you're really looking forward to see how you can assist them. You can't do it alone. So you need other people out there who will come in as donors to support and so on. But I just hope and I wish that many other people will have the heart to partake and join your NGO, to support these people so that they could live healthy and stay fine.
Thank you for that.
So I really appreciate your time today, and for educating us, enlightening us on the effect of kidney disease in the face of COVID-19. And I'm sure that a lot of people have actually learned from you today. And many people will also try to follow the preventive guidelines that you have mentioned, so that they can also stay safe in this pandemic situation. Thank you so much for your time. I appreciate it. Till same time on Emporium Forum, I am Imelda Essing. Remain blessed.